All right, joining me on the hotline as we do each and every week is Dr. Dan Zanotti from the Center for Orthopedics with an injury update. My buddy, who I play tennis with every single day, his name's Chris. He has the worst plantar fasciitis that I've ever seen. I mean, he can barely walk, yet the guy comes out there every day on the tennis court. I'm like, dude, you need to take a rest. You need to sleep in this splint and it'll go away. Am I giving him the right advice?
Yes, you can use the splint. There are lots of treatments for plantar fasciitis. I know we've talked about tennis elbow in the past, and it's sort of analogous to that. It's sort of the tennis elbow of the foot in the sense that it's inflammation of the plantar fascia or the soft tissues that are underneath the foot, and it's very annoying and it's very hard to get rid of. There are lots of things you can do, and the brace is one of them, but there's also some really good physical therapy things you can do. There's medicines you can take. There's lots of different modalities that we use procedure-wise, so there's plenty of treatments available now for plantar fasciitis.
Is it just one of those things that becomes like an overuse type of injury? Is that where most of the issues stem from?
You can get it for a number of reasons. Sometimes you actually have an injury, like if you fall and land on your heel, a bad bruise can set it off. Sometimes it's bad shoe wear. Sometimes it just happens without a reason. But it's inflammation of that heel cord or the plantar fascia, and because you step on it constantly, it never gets a chance to heal. So sometimes it does take a little bit of work and effort to get rid of it.
I have heard of a few people in my life, buddies of mine, that have had the fascia released and they've had like no issues with it. Is that pretty common?
It's not a common surgery, and there are some side effects to that surgery. It can really cause some permanent issues with your arch and alignment of your foot. So it's certainly not something that we would recommend initially, but there are people that do that, and there are times where nothing else is working that becomes an option.
Well, let's do this first. If you folks out there are dealing with it, anybody you know or you personally are dealing with it, you call the Center for Orthopedics today at 440-329-2800, and you go see my team at the Center for Orthopedics, and they'll determine what you need, right, Doc?
Absolutely. Happy to take care of anybody.
Well, there he is, Dr. Dan Zanotti, with the best insight you're going to find on any injury out there. Of course, if you guys out there have questions or concerns, give him a call today, 440-329-2800.